Monday Health Minutes, sponsored by Valley Health.
I'm Melanie Schaefer. This is Valley Health Minutes. Today we're talking about a problem that affects so many families in our region, all around the world. We're talking about addiction and how you can figure out if your family is dealing with that, how you can help your family. So Dr. David Wolfe is here with us today. He's a clinical psychologist giving us some information on how we can deal with this. How do you know if your family has a problem with addiction?
Well, one of the main things that we look at with diagnosing addiction is when it's causing clinically significant impairment. So that means interference in somebody's daily life or important areas of their life like job, social relationships, education, occupation, things like that. So when it's causing those clinically significant impairments in those areas, or just a lot of distress in somebody's life.
So if we're talking about illicit drugs or alcohol or even gambling, what are some indicators that those items could be at play?
And you're going to look at interference in important areas of somebody's life like job, education, social relationships, but then you're also going to look for specific behaviors like lying, stealing, involvement in criminal activities. You're going to look at things like that. You're also going to look at impairment in daily activities of daily living, so like hygiene, sleep, just mood shifts, mood swings, things like that. So those are the main areas.
So if you believe your loved one might be using drugs, beginning addiction to alcohol, what's the best approach to bringing it up to them? It's so hard.
It is.
When this is at play in your family. Yeah,
I think a direct approach is the best way to go about it. There's a lot of stigma in addiction, so you want to look at the person's behavior, not so much them as a person, as an individual. You're not going to try to shame them, tell them they're bad for what they're doing. You're going to look at, like, these are the behaviors that we see, you're missing out on important opportunities, you're not following through with obligations, things like that. So you focus on, like, what they're doing, not who they are as a person, and just pointing out all the things that you see, but you want to be direct. You want to tell them that you care about them and that you want them to get help. And sometimes, we talk about interventions, and that's something, there's a TV show even about that, So you think of like interventions, which can be successful, sometimes not, but sometimes there is safety in numbers and gathering like everyone in the family or friends or loved ones to say, we all see this kind of behavior and we all see it as a problem.
What happens when they're not receptive, when they don't want to admit it, they don't want to discuss it? Yeah. What do you do then? Yeah,
and that is true. A lot of people are not going to get help until they are ready to get help. So what you can do is set some firm boundaries, identify these are the behaviors that we're willing to tolerate, these we will not tolerate. There are more extreme measures that you can take, like an involuntary mental hygiene petition, which would involuntarily place somebody into treatment, but sometimes those don't always get approved for addiction, to be honest. So you can take some more extreme measures like that, but it's just kind of not always going to go through. But yeah, just setting firm boundaries, making sure that you're going to accept certain things and not accept other things.
And let them know they have choices to make too,
sure.
I guess, and what you're willing to tolerate. I like that. That's interesting. So best case scenario, you present them with your concerns and they are ready to get help. Then what should you do?
You can definitely call any of our Valley Health offices to get started on the right path. A lot of our addiction services are either at the Highline office or the Hurricane office. But you can call. We have lots of different options. There's individual therapy. We have a medication-assisted treatment program, which is Suboxone for opioid use disorder. You can get involved in those things. But yeah, definitely just make some calls, find out what's available out there. At the Highline office, we have behavioral health advocates that can guide you on the right path.
So we've talked about all kinds of different options for people. Many people have heard about families enabling the addict.
Sure.
What does that look like? Explain that to us.
Enabling is basically anything that a family member or loved one is doing that is preventing an individual who is having some trouble with addiction from not experiencing significant consequences for their addiction, or you're helping to kind of make sure that they can maintain their addiction. So that would be things like giving these individuals money when you know that they're probably spending it on something they shouldn't. Not filing charges sometimes, if a family member is stealing from you, and not filing charges so they're not receiving consequences like that. Or if they do have charges, helping them to sort of get out of trouble, those are definitely all enabling behaviors.
So many things to consider when you feel like your family member or your family is dealing with addiction. Thank you so much for giving us some options to think about and ways to help.
Sure.
Dr. Wolfe, thanks for being here. Thanks for being here for Valley Health Minutes. I'll see you next week.